Hi, I'm Brian. Thanks for joining us for the Yokem Connection, where we feature the everyday heroes of our community. The Arklatex is full of great people with great stories. We're proud to be able to share one of them with you today. Find out what's happening right here at the Yokem Connection.
We're at the MLK Health Center Pharmacy with Jordan Scroggs. Jordan, so glad to have you back.
Absolutely. Thank you for talking with me today.
It's been a couple of years since we've done one of
It
these.
has.
And can you walk us through what you do on a day-to-day basis here?
Absolutely. So the MLK Health Center and Pharmacy is a free clinic and a free pharmacy, and we work with adults who fall in the insurance gap. So they're making too much money to qualify for Medicaid, but they can't afford private insurance and their employer does not offer them a plan. So the people we serve are truly without access to health care.
And you're not just a pharmacy. Sometimes I think that when I hear the name, but I see that other doctors like Dr. Robert Goodman volunteers here.
No, so we are a full-service primary care clinic. So our patients come, they get to see their provider, including Dr. Goodman. We have a lab on site, we have a dietitian on staff, we have a certified diabetes educator to work with newly diagnosed diabetics, and then of course we do have the pharmacy on site so our patients get their medications when they come for their appointment.
And are your patients adults or do you also accept children?
So we work exclusively with adults, must be 18 or older, and have a diagnosed chronic condition like diabetes, high blood pressure, high cholesterol, thyroid issues, asthma, COPD, things that need a consistent chronic management of the disease.
And there have been some changes to Medicaid lately.
Yes, so during the pandemic, Medicaid suspended the eligibility requirements to ensure that individuals did not lose access to their health care coverage during the pandemic. Now that we're moving past the pandemic in many ways, Medicaid offices across the nation are starting to reinforce eligibility requirements. And the Kaiser Foundation is estimating that between 4 and 15 million people across our country are going to lose their Medicaid benefits this year.
15 million people.
That's
Wow.
a lot. And so the question becomes, where do these people go for their health care? And that's why centers like the MLK Health Center and free clinics across the nation are such a critical asset to our communities, because we can come alongside people who fall in that gap, right? So they don't qualify for Medicaid, but they can't afford private insurance. And we become their health home so that they're not left without access to care.
That does seem like a big gap and like a growing gap these days.
Absolutely, especially with the Medicaid reinforcement of the eligibility. 1.9 million people in Louisiana depend on Medicaid, and so we anticipate there are going to be a number of Louisianians this year who are going to lose their coverage. Our Medicaid office, our state Medicaid office, is launching what they're calling the Pink Letter campaign. So if you are receiving Medicaid benefits, you should get a pink letter in the mail from Medicaid walking you through the process to not reapply, but reconfirm your eligibility. If you do not get your pink letter, that means Medicaid does not have your correct contact information. You have to call and update your contact information so they can send you the letter. Because even if you are technically eligible, if you don't supply the documentation, you will lose your benefits this year.
And what is the time frame for receiving the letter?
I know that the enrollment period is ending March 31st, so to my understanding, the letters are in the process of going out right now. So hopefully you've gotten your letter if you're receiving benefits, but if you haven't, Medicaid's not going to call you. You have to call them.
And what if you no longer qualify? Where should you go?
If you are in Northwest Louisiana and you've lost your coverage, please call the MLK Health Center and Pharmacy. We're located on Olive Street, and we would love to enroll you in our care if you're eligible. And if you're not, we have resources available that we can help connect you to other resources in the community to make sure that you're not left to struggle alone with your care.
Jordan, what is your model of care?
So MLK, we believe strongly in the patient-centered model of care, and what that does is it puts the individual at the forefront of the care plan, because we believe the environments in which our patients work, play, and live matter, and that impacts their health outcomes. And so it's important to us that our patients have a voice in their care. But beyond that, in terms of person-centered care, we think about not just the quality of care that we're producing, but the environment in which we provide that care. You can see in the background here, we have a mural here today. This was produced by Kathy Cobb.
One of my favorite local artists.
Yes, and we've had a couple of murals by Kathy, our garden mural and then on the side of the building, because we want this to be a warm, welcoming space. We want our patients to know that we value them and that they deserve to have beautiful environments as well.
Tell us about the garden.
So we have a garden learning center on site that produces year-round, and the goal of the garden is to teach our patients how to eat healthier, because we know that food is medicine. What we're putting in our bodies impacts our health. And so we wanted to have a garden that we could bring chefs in to do cooking demonstrations in the waiting room so patients can see it took 5 minutes, handful of ingredients, and they really liked it. We can go to the garden, harvest the ingredients, and then send them home so that they can try to recreate that recipe at home.
I know you mentioned that you have a diabetic program here as well, and I bet that that all ties in.
So diabetes is a growing issue not only in the state of Louisiana, but across our country and across the world. And so it's really important to us that we have tailored diabetic plans. And so we have a certified diabetes educator. So for any of our newly enrolled diabetics or uncontrolled diabetics, and that means their A1C is greater than 9, they get one-on-one counseling with our clinic manager. We have an endocrinologist that comes twice a month so that they get tailored care. We have what's called a CGM program, so they get the monitor on the back of the arm so that they can monitor their blood sugar on a 24-hour cycle. And of course, then we have the pharmacy on site to make sure that they're never without their insulin.
And is that insulin, does it come to them for free here?
Yes, everything we provide here is at no cost to our patients. They never pay a dime.
Wow, what a resource for the Shreveport-Bossier area.
Absolutely.
Now, Jordan, where can our viewers go to learn more?
www.mlkhealth.org.
Thanks for joining us.
Of course.
Hey, thanks again for joining us for the Yokem Connection. You know, we are always looking for better ways to serve our area, and Yokem Toyota could really use your help to do even more in our community. You have an idea that could make a difference and help make Shreveport even better? Well, visit YokemToyota.com today to see how Yokem Toyota is involved in our community. Or request that we feature your organization and what it's doing here in the Shreveport area. Together, we can make an impact in our community. That's what it's all about. And that's the Yokem Connection.